I got this comment on one of my older YouTube videos. Co-sleeping can be done safely. 6, maybe 5 simple words, and yet there's so much to unpack there. So first off, let's just put this out there that sleeping and sleep habits is something that parents can feel very ashamed about. And I don't want to lump sleep alone into this category because eating habits, schooling habits, parenting behavioral habits, those are also things that parents can feel ashamed about when it comes to their children and discussing these habits. But the reason why sleep is very unique to us as pediatricians is because depending on the age, it can definitely put your child at risk of death, which is the last thing we want happening to your child. So if you find that we are outspoken on this app, I apologize, but that's because many of us do feel passionate about keeping children alive and spreading the right information. I know for many parents, I won't be naive enough to say that there aren't things that are hidden from us in the exam room during checkup. At the end of the day, I think I speak for all pediatricians that we all strive to have an open, trusting relationship with our patients, with our families. Are some of us maybe a little bit better equipped to do that, or are some patients a little bit more in tune with their pediatrician? Absolutely, and that's exactly where you want to be. That is the goal, to find a pediatrician that you jive with, who you trust. Unfortunately, these broad claims made without data to back up those claims can be detrimental, especially depending, again, on the age of the child, the risk factors of the child, the parent, the environment. There's a lot to unpack here. If anything, I'd say that's my takeaway. Make sure you can find a pediatrician who you can trust and talk to about this topic, because there is a lot to unpack and you want to talk to somebody who is a trusted professional in this regard. Sleep struggles are not easy. Parental anxiety is not easy. I will 100% admit those things. And thoughts cross our minds in the middle of the night, and we aren't sure how to handle them, where they fall on the safety spectrum, and your pediatrician might be a great resource to talk to about this.